Okay, welcome back to my video. Today I'm going to be discussing why I decided to go to UMKC's 6-year med program. If you're new, welcome. I'm Michelle. I'm a second-year med student at UMKC's 6-year med program, and make sure to subscribe right here and like this video because I'll be posting new content every week. So let's get started. Okay, wait, first thing, I kind of want to talk about this a little bit. There's a lot of stigma against 6-year med programs or combined med programs, accelerated med programs, specifically in general. A lot of people say that you won't have any social life, you're constantly studying, you're constantly stressed. I did experience a lot of people saying that to me, fellow students, fellow teachers, but to be fair, I did have a little bit of inside info and I didn't really let those comments get to me because both of my parents went through 6-year med programs themselves and they really enjoyed it, and they do think it is the best way to go into the medical field if you reach that decision early on. It's the easiest, best way, saves time. And also regarding the social life stuff, yes, I am taking classes during the summer. I do have 5 weeks of summer vacation total, which isn't too bad for me. And I personally like having shorter breaks because if I have like 3 months off, I do not know what to do with myself. I end up becoming a literal potato. Like actually, I'll be in my room all day watching K-dramas, doing literally nothing. So like I like having short dispersed breaks between, so it works out with my schedule and my preferences. And during the summer, if you do want to get into med school as an undergrad going the traditional route within the 4 years, you're going to have to grind during the summer too. You've got to get that research, got to buff up your resume, study through the MCAT. So regardless, your summers are still going to be busy, whether you choose to go to a combined med program or if you want to go the traditional route. If you want to go into medicine, you're going to have to grind during the summer. Okay, now moving on to UMKC specifically, let me whip out my handy list of reasons why I personally chose UMKC. So that means you save 2 years if you were going to go to the traditional 4 years of undergrad, 4 years of med school route. To break it down to you, I applied to UMKC's program when I was 18, a senior in high school, got accepted while I was still 18, a senior in high school. By the time I am 24, I will be done with medical school and officially a doctor. Another thing is that there is not a lot of 6-year med programs in the United States. There's actually only 3 total, including UMKC's to be specific. And one thing that was a big turnoff to me about the medical field is that it takes a very long time. It's a very long process. And personally speaking, I did not want to be ancient before I could actually start practicing medicine and seeing patients. So I decided if I were going to go into medicine, I wanted to be done with school and start training as fast as possible, which is why I applied to UMKC's 6-year med program in general, just because there's only 3 med programs in the country and UMKC is by far the most established and most prestigious of those 3. The other med school programs I applied to, I only applied actually to accelerated combined med programs in general, going back to the point in which if I were to really pursue medicine, I want to be young and fresh by the time I get out. That was a really big draw to me because not all of the med programs or combined med programs in the United States can claim that. Reasons why I didn't want to take the MCAT. Number 1, I really dislike standardized testing. I did not like studying for the SAT, ACT. Did I do it? Yes. Did I do well? Yes. But I hated the whole process of it. Do not like sitting down for hours taking a test, one test. And that's like what? The SAT, ACT, those take what, 3 to 4 hours? Same with AP exams. MCAT is like almost, I don't know specific logistics because that's something I haven't had to worry about, but it's basically double the time and double the content and probably double the intensity and level of difficulty. There's stuff on the MCAT that's tested that, honestly speaking, you don't need to really use in the medical field as a practicing physician. I've heard this from my parents, other doctors, other medical students, residents. Yeah, so for example, physics. I was not a big fan of physics in high school. I would do it it took me a little bit longer than most people to understand and fully grasp and visualize the concept of how things fall, projectiles. Not a fan. I had a great physics teacher though. I just wasn't really a fan of physics, the content in general. And on MCAT you use physics. But as a practicing physician, do you use physics? No. I'd rather spend time studying and working on improving myself on things to help patients I will be seeing in the future and not focusing on seemingly irrelevant things for my future career in hand. It's mainly the assurance of being accepted into medical school. Not every program or combined program can say this. It varies on the different programs, but at UMKC, once you're accepted into the program and with the Toledo chemistry exam that you take during your interview, if you pass and the admissions board accepts you as a person, then you're accepted into their medical school. Some programs varying on the programs. Some you have a higher priority status than the other applicants. It depends, it varies. At UMKC, you have an automatic assurance that you're accepted. And this is a pretty significant deal. For example, the rest of my classmates in the program, we're not worried about competing against each other for grades because we're all accepted into the med program. So it's more of a collaborative feel. If someone's struggling in a class, has questions on a subject, we'll study together, no sabotage, none of that like pre-med horror stories that go on. I saw videos in which they say make this comment section sound like a toxic pre-med group chat. So none of that business going on, and yes, in high school it was pretty competitive and I didn't really like just having all the stress of competing against my fellow classmates to get certain spots and certain rankings and get better grades in order to get into college, because everyone in the program in high school, they worked really hard to get accepted. They can now relax and everyone's has a more collaborative feel, and I really like that because I was kind of, honestly, frankly speaking, a little burnt out from high school, so I wanted to relax and form strong connections and genuine connections with people that are my classmates, and it's a lot easier when you're not competing against them for a spot in medical school. At UMKC specifically, they have something that's called docent, and you start from your very first year. And basically what it is, it's a group of 11 other medical students and one attending physician. And the physician, so you have a medical docent, so you have a medical physician, it can be an ER doctor, pediatrician, just depends on the draw, stick of the draw, whatever the term is that you get. And then you also have a psychiatric docent, so you'll have a psychiatrist that you follow and see kind of what their job is all about, and they'll teach you about psychiatric interviewing and just kind of skills that you need to know for that specific field. So for me, for example, I had an ER physician as my medical docent during my first year, and I'll have her again my second year too. I really love her. She is the best. Again, this is depending on your physician, but just the chance that you get an opportunity to form a close relationship with a physician and have them take you under their wing and guide you, and also they grade you, but they really want to be there to help you. Basically, she taught us how to interview patients, how to collect patient history, do the HPI, a little bit of how to give patient presentations, and which are going to be really useful going into our clinical rotation. So a year from now, I'll be starting my official clinical rotations and just building that basic skill set. And it's really valuable starting from your first year, and it's really motivating and inspiring actually, because it gives you a little bit of a glimpse into the future of what you're going to be doing. Again, about the docent situation, so at UMKC, it's divided into 6 years. Years 1 and 2, you'll stay in the same docent. The people in your docent will be other people within your same class. And then once you go on to year 3 and start your official clinical rotations, you'll still have docent, but will be with a different group. So you're combined with years 3 through 6. So that's also another opportunity to talk to upper year med students, become friends with them, get advice, and that's what I also really liked about the program. Granted, I'm not at that stage yet, but it was a big draw for me. And my parents were taught, as I mentioned before, they both went to 6-year med programs, and they're also just in the medical field in general. They're both physicians. They mentioned how valuable that aspect of docent is, especially starting early and starting from your first year, because you really gain skills, and that gives you an advantage over other people. When you go into residency, you'll just have more of a background base and foundation of general clinical knowledge and patient presentation knowledge and skills. I wouldn't know this obviously before applying, or as I was applying, or before I attended, but I do really still strongly stand by what I'm saying right now in this video, because I love docent. So kind of some of the things that I've done so far, the medical knowledge or experience that I've gained in the ER. I was able to staple a patient's head. I've been taught how to do sutures, read EKGs, put EKGs on people. Obviously you have like the basic patient presentations. I've seen countless of patients, got to know their story, practice taking notes. Yes, I still need to practice. I'm still building my skills, so I'm definitely a lot more confident than when I was first starting, and it's definitely preparing me for my official clinical rotations next year. And also some of the other stuff that I did, I got to help orthopedic residents reduce a patient's fractured knee. That was quite an experience, and it made me really understand why there's a stereotype of an orthopedic surgeon being a jock in high school, because there's a lot of work that goes into reducing a knee fracture, especially that orthopedic surgeons have to do. In the room, there's a team of like 6 people in the room, and us medical students, we're holding down the patient's hips, stabilizing the patient. 2 orthopedic residents were yanking at the patient's knee because it was dislocated and also fractured, trying to get it into the correct position before they send the patient to surgery. There's another resident getting the x-ray, so a huge x-ray machine, and then one more was delivering anesthesia. So it was very hectic, but very exciting energy. I would not have this experience if I was not at UMKC, because who's gonna let a 19-year-old help reduce fractured knee if you're not affiliated with a certain medical program or university? It's just hard to get those experiences. It's something I hold dear to my heart. Within the first month or 2 of starting UMKC, so back in the fall, we went into the emergency room and we're learning how to do EKGs and practicing putting them all over each other, learning about sinus rhythms and what to look for regular EKG readings. And then a patient comes in and his entire calf is blown off due to a shotgun. And then another patient came in who coded. I truly did feel like I was in a Grey's Anatomy's episode. This is what I think about whenever I'm sitting down studying, not wanting to study. And I just think about these moments I get motivated and inspired. And it reaffirms my decision of why I wanted to go to the medical field, and that I did make a good choice for myself. So for point number 5, this is kind of contingent with point number 4. You do take medical school courses from day 1. So docent, you also get a grade for that, and that's part of your med school GPA. During my first semester at UMKC, I took anatomy. I guess it was technically an introductory anatomy course. I did have a little bit of background knowledge because I took anatomy in high school through the medical academy that I was in. I definitely did not go as in-depth in my high school course as I did starting at UMKC. So for the bone unit, we had to memorize all the different facial bones, cranial bones. I remember sitting down and like memorizing all the different articulations of the bones. And for the muscles unit, we had to learn their origin, insertion, action, blood vessels, which like where they traveled. You had to be able to draw it out yourself. It's definitely a lot of content. You do have to spend a significant amount of time studying. I actually do think though I overstudied for that class, but I don't regret it since it helped me. Anatomy is something that I'm going to need to know. When you go into the medical field, you need to know the basic structures of the human body in order to be able to treat your patients. And I'm taking anatomy again, or within the curriculum, you'll go over it, you'll do it again and again and again. So I took anatomy my first year, and I'll be taking it again, but more in depth second year in multiple courses. Same with microbiology. We'll be taking medical microbiology. So it's all repetition, and it's actually a good thing about the program because it's not as overwhelming, I think, compared to other courses, because you've had a brief introduction to it as a younger year, but then you're able to go more in depth into it. So it's kind of, you have your basic foundation knowledge, but then you build off of that instead of just expecting to have the whole building structure finished from day one or without any solid foundation. So you have that already predetermined medical knowledge starting when you're younger. I think a main concern with programs like these are burnout. And for me personally, just learning about relevant material and then seeing it applied within the hospital setting, it really helps me be motivated, optimistic about what I'm doing, and it gives me kind of a purpose in my studies, and it helps me study more and study longer. So yeah, that's the end of this video. Let me know what your guys' thoughts are. Leave me any questions below in the comments, and I'll do my best to answer them as thoroughly as possible. Make sure to subscribe again, because I'll be posting new content every week, and let me know what kind of content you guys would like to see. And with that, I'm going to go study now because I have finals next week. So yeah, thanks for watching. Bye.